started, as usual, please put your laptops away so we can pay attention to our practice panel. The order of events for today, we will be talking about our practice assignments after break, guidance about the presentation guidelines, returning the evaluation worksheet, the final proposal guidelines, and returning your drafts, draft 2A and 2B of the proposal during the break. I think we'll be doing that.
And we will be celebrating Dr. Weiss's birthday. Her birthday is actually on Friday, but she will be off celebrating her birthday, and so we're going to celebrate this evening. And so we have homemade chocolate chip cookies for break. There's enough for everybody, including our panelists. And we have balloons, and it's just a festive environment. But in order to get a cookie, you will have to sign the poster. So this will be our birthday card poster. If you have 2 cookies, you have to sign it twice. So you'll know.
Thank you very much.
Thank you.
And I highly recommend the cookies. They're very, very good. I'm very excited about this. Okay, well today is one of Lee's and mine's favorite classes of the year. This is something we've been doing for a while, and it's our practice panel. Bring it in. Usually it's the day that draft 1 and 2 are due, but this time it's when we return, being returned, but where we ask students who have recently graduated, only a year or 2 out of taking this class, with Dr. Pearson and I, to come back and talk a little bit about their experiences, both within the program, what they're doing now, how this class has absolutely changed their lives and made all the difference in the world. For the better, of course, and all the skills that they learned. But really being able to share with you a little bit about what it looks like, a year, 2, 3 years out from where you're sitting right now. So I'll do some quick introductions, and then I'll turn it over to Dr. Pearson from moderating. First we have Chloe Rodriguez Ramos. She graduated in May 2021. You were in our 2020 class.
Yes.
That was a class, spring 2020, y'all. The first year of PUBH 735 as well. And as of October last year, she started working for the Department of Epidemiology and Biostatistics under Dr. Melissa Nolan's Laboratory of Vector-Borne and Zoonotic Diseases, doing very important work. She's the program coordinator and the research coordinator for the lab, and really focuses her time on the statewide initiative titled All in SC. And that is funded by CDC and DHEC to understand the utility and capability for DHEC to promote the use of at-home testing for future pandemic response. And currently she works to help coordinate all aspects of the project, so the creation, IRB, grant documentation, recruitment, data collection, data analysis, data dissemination, everything you guys are talking about doing in your proposals, and assisting with other things as needed. The 5% other duties as assigned that we all have, that'd be very familiar in any PD that you guys have in the future. We also have Landon Campbell, who is in our HPEB 702 class in 2019, so the last year that we had that class, and you had the joy of implementation monitoring as part. We've referenced when we tried to do pre-seed, post-seed, and implementation monitoring at the same time. That was a good time as well. And he is an SC native, originally from Spartanburg, and his undergraduate degree is in exercise science, and his master's is from here. He's worked for several years in the fitness industry, and now he works with the Division of Nutrition, Physical Activity, and Obesity in DHEC's central office. And he plans to work in state government to gain practical experience prior to returning to school for his doctorate. And finally, we have Janishaance, who was also in the 2020 class, and she graduated in 2020 and is now the Research Associate and Project Coordinator at the Center for Applied Research and Evaluation, known as CARE, within the Arnold School. Primarily, Janisha is coordinating a statewide effort to address social determinants of health in South Carolina with a special focus on racial equity. She also evaluates the COPE program within the Beckman Center for Mental Health Services, which aims to screen youth aged 10 to 25 to prevent and promote early detection of psychosis. So thanks all of you guys for being here. We really appreciate it.
We truly do appreciate you being here, and as Dr. Weiss said, this is our favorite class of the year because it's fun to have a reunion with some of our former students, but it's also such an inspiring time to think about what your future is going to look like as you move beyond proposal writing in this class and move to your future careers as you begin to think of yourselves in these seats in the next couple of years. So thank you again for being here. I think the best way to start this panel is really by offering an opportunity for each of our panelists to kind of begin to tell their own story. So if you could kind of reflect first on your experience in the program, but also talk about that transition from graduation to employment, and all of you are thankfully gainfully employed, and you're all smiling about that. But it'd be great to hear in your own words your story of kind of how you made that leap from the classroom to the workforce. And so if you could take a few minutes to do that, then we'll start following up with questions. So I'm going to turn to Janisha first to share her story.
Good afternoon, everyone. My name is Janishaance. I did graduate in December of 2020. So my experience in the program, I came in at a really weird time, and we were kind of doing the reaccreditation and having to readjust all of the classes and schedules to match that. So my experience was pretty unique, but also really awesome. I think I learned a lot, and it prepared me a lot for what I'm doing now. So I started actually in the spring, January of 2019, which seems like so long ago.
Pre-pandemic.
Pre-pandemic. Oh, really good times. And I was an HPV student, of course, and I've really realized, like, during that particular time that I think I could, like, move mountains. Like, with the flexibility of the reaccreditation and moving classes around, I kind of found a way to, like, make my coursework work for me. And I did an independent study. I did a very non-traditional practicum where I got to teach a class of honors students here at the university about a mutual aid organization. So that was a lot of fun. And so after that, finishing my practicum experience, I was a graduate assistant at CARE, of course, and then got hired full-time right after I graduated. So yeah, graduate assistant, just coordinating a project, which I hadn't really had much project coordination experience before, but it was a learning curve that I think I did pretty well picking up on. And so we start with our initiative to address social determinants of health in South Carolina, which is something that we wanted to do. Well, our funders, the Blue Cross Blue Shield and the Duke Endowment, were like, well, we keep talking about addressing social determinants of health in South Carolina, but what are we doing to address it? So that kind of started our whole journey of trying to address social determinants of health in South Carolina. And so from there, I was just working to coordinate this project, pull together different groups of work groups, we call them cores, to try to get all of our brains together and say, like, what can we do collectively as a state in South Carolina to address the social determinants of health? So yes, we have people who are hungry, especially with the pandemic. It's gotten a lot worse. So why are they hungry? Kind of getting behind those root causes. So that's a little bit about what I do. And so yeah, I've been working at CARE since the beginning of 2020, but full-time since the beginning of 2021. And I've really enjoyed my experience of kind of coordinating this project, putting these people together, meetings, and getting to know all the different national, local stakeholders from nonprofits and state agencies all around South Carolina. So that's a brief rundown of what I do.
That's a lot, and a great rundown, and really good reflection on the pre-pandemic days that some of us may be able to remember if we try hard enough. Many folks in this class have written into their proposals project and program coordinators, and you probably did too when you were in this class, and now you are one. So it's a big transition to move into that reality. So thank you for sharing that early version of your story. We'll come back to you for more on that. Landon, tell us your story, please.
So my name is Landon, first off, and I hate to have to follow you up on that one because that was pretty impressive. I would say that my experience for the first year or so of my master's was pretty much normal, the way that you guys have probably experienced it towards the end of your master's. So pre-pandemic, I got to experience their class pre-pandemic, which was awesome. But as you guys know, the work on that class was pretty impressive. I would definitely say that was my good introduction as to what is actually going to be expected of you in any kind of work environment whenever you actually finish your degree. So give you guys an asterisk, my practicum experience and even the last semester, it was during 2020, during the first really high wave. That was my last semester of actual classes, so those were all online, and I enjoyed them. I know that all of the staff here really did their best to try to transition it, as you guys are probably aware of. But my practicum experience was actually with Dr. Russell Pate, and it ended up actually having to be online throughout the summer. The focus of that was with the National Physical Activity Plan Alliance and the work that they were doing, and mainly in surveillance and evaluation. And that's what really got me interested in evaluation and really got me interested in program coordination. So that's kind of what led me over the next year to start applying to jobs around South Carolina within that area. And I was actually lucky enough to find a HEAL coordinator position at the Division of Nutrition, Physical Activity, and Obesity over at DHEC, which I started back in November. And my job right now is quality improvement. A lot of it has to do with admin work, but I'm also on evaluation committee for Healthy Palmetto, which is something we'll get into a little bit later.
You mentioned a lot of the key words that we focus on in this class, and so we'll come back to you about how you're translating some of the skills that you gained in this class. But next we'll move to Chloe to hear a little bit of your story.
Sure. Hi, everyone. So my name is Chloe. I have two last names, Rodriguez Ramos. You can just use the first one. So I have a very interesting story. My first experience with public health ever was through my master's. I have a background in biology. Was really interested in veterinary medicine. I worked in an animal hospital for 5 years of my life and found out towards the end of where I needed to make my decision for grad school that wasn't what I wanted to pursue. But I was really interested in infectious disease through that experience. So started here in fall of 2019. And it was amazing. I dipped my toes in everything public health that I could because I didn't exactly know what I wanted to concentrate in. But I had chosen to apply for the concentration in epidemiology. So worked with Dr. Weiss. My first experience with a graduate assistantship was with her when she was with the South Carolina Institute of Medicine and Public Health. So I worked there, got some experience with public health policy, legislators, working with them, learning about public health issues affecting the state, how we can better improve policy. Got really good experience there. Went on to work with the Institute for Families and Society on a qualitative project titled the Voices Initiative. So we worked with, did interviews with pregnant, birthing, or postpartum women about their pandemic experience and their experience with Medicaid and Medicaid services at that time, as well as emergency Medicaid. So collected all that data all throughout my spring 2020 and fall 2020 online. I was only able to do one semester in person. Everything else was done online. So did that and then actually was able to turn that data into a theatrical piece. So finding the public health and art combination of those two things, presenting a theatrical piece to maternal child health stakeholders, and getting their voices out. So I really grew to love qualitative research as well, with a really big background in quantitative research, which was what I was learning during my program. And so that brings me to where I am now, still interested in that infectious disease sort of aspect. So now I work as a program coordinator for the Laboratory of Vector-Borne and Zoonotic Diseases, which is just 3 floors up. And so working with Dr. Nolan on, again, the All-NSC project. That is also a mixed method study, so I'm able to do some qualitative and quantitative research there. But as a program coordinator, I'm going through everything that I wrote in paper in this class is what I'm doing in person, hands-on. So all the way from needs assessments to everything, epidemiology to actual implementation of the program, data collection, evaluation, everything that I learned here. This is probably, again, like Landon said, the closest thing that I could have gotten to actually doing it in person. That's what I'm doing now. So yeah, super rewarding experience. It was all over the place. It's not linear at all, but yeah, I really enjoy what I do, and so yeah, thank you again for having me.
We didn't even have to prompt them to say that.
No, not at all. No.
I do have some questions for each of you that want to make sure that you share certain elements of your story, but I already see a hand up in the front row.
Just
So
a quick
Joey.
shout out. We had a few of us had Dr. Billings last semester.
Oh,
So
yeah.
I did go to the show and it was amazing. So like all your hard work, like we got to see it.
Oh, thank you so much.
That's
That's so awesome.
I've heard some finger snaps.
Yeah.
That's awesome. Thank you for mentioning that, Joey. That really is a fascinating project that you put together there.
Yeah,
I'd love to see that myself. So all of you have thankfully landed in an employment setting and have been able to find a path in your early career. But I know that that's not an easy process. And what seems seamless when you look back doesn't feel that way when you're going through it. So I'd like to ask if you would to comment on what are some of the challenges that you encountered and how did you overcome those challenges to kind of get to where you are in your first job placement post-graduation?
So I guess I'll go first. So challenges, where to start? But COVID, first of all, I think that's a pretty across the board thing. Really getting hired at my GA-ship, and then a month later, everything shutting down, learning how to adjust virtually, learning how to coordinate projects virtually, how to meet virtually, scheduling Zoom meetings, really like getting into all that. Wow, trying to adjust to life virtually, basically, was a big challenge. And then for me, I had a lot of personal things going on simultaneously to COVID, which was great, but another thing that I had to go through. And so by the time it was like, okay, it's 3 months from graduation, I gotta figure out something to do. And so I just kind of was like, well, is it possible to stay at my GA? Like, has that ever happened? And yeah, I guess it was. So so I basically just kind of had to like ask around and do all the interviews and stuff, but hopefully I showed that I was still committed to it and I continued on full time.
Awesome, thank you for sharing that, Janisha. Landon?
So I'm going to bring this back up. I feel like everybody is pretty much in the same bus for the last 2 years. We all know how hard it's been and how much we've actually had to change our lives. So for me, my last semester where I started to actually apply, I tried to take everybody's advice and start to apply to jobs like 4 to 5 months before I actually graduated, which just happened to coincide with the first big wave of COVID. And whenever I graduated in August that year, that just happened to coincide with the second big wave of COVID.
Sounds like there's a theme here.
I'm not going to graduate again for a long time. But I would say that whole time I stuck with trying to apply to at least 4 to 5 jobs a week. And my main issue that I had while I was going through that process, aside from COVID and personal issues and all of that, was just trying to narrow down really what I wanted to do and what I wanted to apply for, because especially during COVID, there were so many things to apply to, like contact tracers or epidemiologists or so forth, and figuring out really what you like to do was a big problem. And the second thing I'll say, and Megan has also told me this several times, is write your cover letters for each job and actually make them make sense for the job. And that takes a lot of time. So I would say that was a big part of my experience, actually trying to find a job. But the last thing I think I could tell you guys that I would really try to take away from this is use these people as a resource. Like whatever teachers you have, whatever connections you have here, try to get to know them as well as you possibly can, because the one thing I've learned actually working in this field is that everybody is connected more or less, and they will know somebody that has a job that is related to what you like. So I will definitely say that, and I will definitely say that waiting it out and sticking with it is worth it, and you will find something that you like to do.
Very good advice. Chloe?
And so I have a lot of firsts in my life. So it was my first time getting public health. This was my first time actually applying for a job. I'd actually never applied for a job before. Working in the animal hospital, I was just kind of through a connection, made that connection there, never actually had to fill out any paperwork or go through that sort of normal process of looking for something. And so I was a little behind on the job search, I can't lie. I started pretty late. It was really close to graduation when I actually started looking, just because I didn't really know what I wanted to do. And so with infectious disease, looking through like LinkedIn and postings and stuff, everything was COVID, and that is not what I wanted to focus on. And so I applied for many jobs. I applied for things like research associate positions, program coordinator positions, with specific universities and such. I was just throwing myself out there because you never know, you can land something and boom, it's done. So got my rejections, which is totally normal. It was really sad at first, but it happens. And so I was feeling a little lost. And so I went back, reached out to my professors. I did some work with Dr. Nolan. Oh, gosh, this was so long ago. It was like my first semester here, and I hadn't spoken to her in a while because it was just a lot going on in my life with COVID and everything. We weren't keeping up. And so I said, I really enjoyed working with you on that one study that we did together for those few weeks, and I would love a chance to continue that, potentially in a role in your lab. She was like, call me right now. Like, I need you here now. And so I started immediately. I mean, literally within 2 or 3 weeks of that phone call, I moved back to Columbia. I had just moved out of Columbia back to my home in Greenville. Yeah, so moved right back in and started immediately in October, and I've been here ever since. So yeah, it really happened out of nowhere, and I started with this program coordinator position. It is a grant, and so it's a temporary, or there could be the potential for it to end, or if we see more funding, it can be extended after that. But I'm really hoping, I really needed more experience with infectious disease, especially since COVID happened. I went home. I didn't get to really get into it, so this has been a great help to kind of pursue this, sort of get more research, so then I could actually find out what I want to do within that realm of infectious disease, because there's just so much. So yeah.
You each have had such unique experiences, but you also share this common denominator of having to navigate COVID, not only through your education, but also the entry into your career path. And so hats off to you for that. When we had this panel last year, it was the first time we'd ever done it virtually, because we were still navigating the virtual world, and I thought, wow, that's a really unique panel that we've assembled. You're the survivors, if you will. You're the ones that endured that process, and are here to tell about it, and we're really grateful for your time in doing that. I'd like to ask each of you to reflect on your time in the program, and not just this class, but other classes, and kind of what you've been able to harvest from your academic process that's helped you as you've started your career. What are some of the key things as you reflect back that have helped you? And I'll come back for ways that we can better enhance that in a moment, but what are some things that you kind of put in your toolbox through your graduate program that have really helped you in these early days and months of your career? Janisa, you're up first on each of these. She's like, I know that, I'm trying to think of my answer.
Yeah, basically. But honestly, so much, especially because I do work for a research center, so much of what I learned in my MPH program, I am now taking to my job, which I am very grateful for. I felt really well prepared for what I was doing. And so, of course, a lot of the qualitative and quantitative methods as well, a lot of evaluation stuff, because I do a little evaluation for a mental health center. So good stuff like that, process evaluation, impact evaluation, all those good words. Also just like, not just the academic parts, but taking into account that like networking and kind of being able to build rapport with people everywhere was a big part of what I'm doing right now. So I think like being able to talk to my professors, and it is a very small world. Please, my boss's boss. Megan is actually on one of the groups that I organize, so having that as well. But otherwise, really being able to like, one of the biggest things I would say that I learned from this program is doing what you like and making it work for you. So I think I really like that. I got to kind of dip into everything that I wanted to do and kind of go with what I was passionate about, and that's really helping me in my job today.
There's a bumper sticker opportunity there with that saying. That's great. Landon.
So I would say that you covered a pretty good bit of it, but I have a couple things to add. Number one, the fact that you guys are exposed to so many different aspects of public health. It just, at least from my experience, my job is a little bit of everything. So you're like, I'm hired as a program coordinator, and like they were saying earlier, that 5% of your job is really like 75% of your job. And you're going to be doing stuff that you didn't learn for the last like 2 years, and you're like, this is not my job description, but it's definitely actually related to what you're doing as far as your work is concerned. So I would definitely say the type of work that you're doing, the breadth of the work that you're doing is nice, and then definitely the connections that you make throughout this program are going to be two really, really important things going forward.
Yeah, and too with this class, I know that, or at least during my time, this was sort of like group projects, is that correct? You guys are working together, and you all have different concentrations, like policy or health promotion education, epidemiology and stuff. So the intersection and seeing where that all kind of flows together and it all lands into one spot where it's like, very successful, and you kind of get to this one big conclusion, and it's like, yeah, we did it. And so yeah, I think in terms of my position now, I'm seeing where all those things coincide, and then I just think you guys mentioned a lot of it. So especially, the program fully prepared me for what I was doing. I mean, there are some things sometimes where I'm like, oh my gosh, what is this? Like, I'm learning something. But a majority of the time, I know exactly what I'm doing. I know exactly what they're asking of me. I'm very into the research side, and so I do a lot of IRBs and grant documentation and data collection and such. And so the first year of the program was really good just to learn more about public health and how everything kind of flows together and seeing and working as a team, because that is a huge part of public health is collaboration. It is all collaboration. And so you end up talking to people that, just focus on different things, but you're trying to get sort of that connection with the community, reaching out to the community that you're trying to serve. And so I think the first year was a lot about collaborating together, working on projects and stuff. The second year was more of a concentration into that EPI portion for me at least. And so I learned about biostatistics, I don't know if you guys like that word, but biostatistics, software, data analysis, just anything like that. I love that stuff. I'm more of a little nerd in the back, and so but I definitely needed that first year just to kind of help me understand what all was public health for myself at least, and then from there concentrate on what I was really focusing on. So, yeah.
Just so this doesn't begin to sound like a promo for the program, I'd like each of you to reflect on what you wish you had learned or known when you were in these seats as you start your career. Because what we try to do through the program is give you that broad exposure and to help to build that toolbox of skills that are needed, whether it's grant writing or proposal development for planning a program or other skills that come from different classes. But we know that the toolbox isn't completely full. As you've started your career, what are some of the things you wish you had known or learned about as you navigated the program? And it doesn't have to be germane specifically to public health, but as you think about those professional skills that you've had to begin to hone in your early careers, what are some of the things you wish you had known, or maybe advice that you would have liked to have heard when you were in these seats?
I would say that I wish I had known, I don't know if I'm answering this question correctly already, but the people that I work with were actually really nice. And so, because I have to contact state leaders, the leader of DSS and DHHS and all of those people. And when I started, I felt kind of inferior, because it's these people are so important, and what if they don't listen to me and whatever else? But they do, and I know I don't feel like an adult, so you say I'm talking to all these real adults, but they don't know what they're doing just as much as you don't know what you're doing.
That's another bumper sticker opportunity right there.
So it's that whole imposter syndrome thing. No one's more quote unquote important than you, and they're going to actually be pretty responsive, surprisingly. So just not being afraid or feeling inferior, or feeling intimidated because someone may be don't feel intimidated because someone may be in a more important position.
Sage advice.
So I would say that this is lightly touched on in a couple classes, and including this class in here, but really going into understanding how funding works in public health. Where does the money come from? How do you get it? How do contracts work? Like private sources of funding versus federal sources of funding and everything that goes with that. I know that's been a part of my job so far that I'm going to be honest, I didn't have a lot of experience before that, and it has been a learning experience. So I'll say it that way for sure. It's been intense for the last couple of months trying to figure all of that out. So
yeah, I was about to say the same thing. Funding, grant writing. I didn't have too much experience with that, and also rejection. So with this class, you write a program. You present it. It's all done. You got a good grade. That's so awesome. But sometimes you write things and they don't get funded, and boom, it's just. And you have to go through the process again of applying for something else, and if you can get funding that way. And so it's a very long process. It's not semester long. It can take forever. And so just that feeling of potentially, I don't want to get depressive, but but yeah, it's a possibility. It happens. It's the real world. And so didn't really get that experience in class and such. So actually seeing it in person has been a little bit shocking, but it happens, and I've accepted it. And so yeah, so that's one thing I feel like could have been touched on a little bit more, I guess.
Well, you created a nice segue to my next question is, how do you stay motivated as you're making that transition from school to work, but also as you navigate those rejections, whether it's a grant that isn't funded or a paper that isn't published or a job application that goes unanswered. How do you stay motivated through that process?
So for me, we're public health people, and I'll just always say I'm not doing this for me, I'm doing this for everyone else so that everyone can have a better quality of life. And that's what keeps me motivated.
Yeah, I think just to expand on that just a little bit, I feel like everybody in this room is interested in some aspect of public health. Like you're trying to take what you're interested in and you're trying to improve and you're trying to give it to as many people as possible, right? Like that's the end goal of whatever job you're gonna end up in this field. And if you keep that in mind, you will eventually start to change some stuff. It's gonna take a long time from what I've seen so far, but it does happen. So you are in this to make people's lives better. I mean, that's really what it is at the end of the day.
Yeah, and I think for us too, the pandemic felt like the end of the world. Like, you know, doing things and it's all gone. And so, and I just lost my train of thought of what I was gonna say, but to keep motivated. So like with the project that I was doing with Dr. Billings, you mentioned with the play, I mean, that was gonna be a completely different project pre-pandemic. And so having that experience of being like something completely destroyed and then still have a successful outcome like that, it just that alone like kept me, you know, just has me in that mindset that it's never the end, or like there's always things that could be like accomplished. And so that keeps me going. So I know that, you know, there's bumps on the road, but there is an end, and you're doing things for the community and you're representing, you know, those individuals that need assistance. And yeah, it's just being able to be that person is enough motivation in itself to keep going. So.
Great responses. I have a targeted question for you.
Oh, great.
Was your theater production recorded?
It was, yes, it was recorded.
Would you be willing to share that recording?
Yes, absolutely, yes.
I'm among a large group that would like to see that.
Yeah, no,
For those who didn't
definitely.
get to see it and do the finger snap earlier.
Yeah.
Yeah, would love to be
Yeah.
able to share that if you're willing. So if you could share that with us,
Definitely.
we will make sure we share it with the class.
Yeah.
So Janisha mentioned something earlier that is inspiring my next question. So I'm going to work in reverse order and give you a little bit of a break, but we'll come back to you for next day and comment on this. But you talked about some of the things that surprised you, like that people are nice, which is a nice surprise. But also that sense of being able to work with folks that may be more senior in their positions, and that was a pleasant surprise for you. Starting with Chloe and working back, what has surprised you the most in your jobs thus far?
That's a good question.
Now you understand what Janice
Yeah,
pressure.
definitely.
I've stumped the panel.
Yeah.
Landon?
Gotcha.
All right, thank you.
Let me keep thinking.
So I'm gonna say this with the understanding that we also had the SCPHA conference last week, and I got to attend that. But the most surprising thing to me going into at least state level work is the breadth of work that's going on in South Carolina. Like, there is somebody funding pretty much everything that you can possibly imagine in this state, and they're just siloed somewhere. But it's being done, and it's awesome to actually be able to see that, especially last week whenever everything was kind of brought together and presented all at once. So it's definitely reassuring to understand how much is actually going on.
And I'll piggyback off of you because the work that I'm doing is specifically to break down those silos so that we can all work together instead of, competing for funding or whatever. So anyways, I'm gonna keep going off of my people are nice. What was surprising was, like, for instance, the leader of DSS is on one of our cores, one of our groups. And I'm always shocked because he's like there and he's engaged every time, even though he's super busy. And so we actually asked a lot of state leaders, like, why are you here? What made you do what you wanted to do? And he said he was actually an adoptee himself. And just hearing all of their stories and hearing, like, so we get a lot of flack for, like, not bringing in people with lived experience, but we also don't acknowledge that we all have our own lived experience and what we can bring to the table and why we want to make the quality of life better for everyone.
I think so. I think I got it. I guess what was surprising in terms of what my work encompasses is how many people need to be involved in it. I at first thought, you need the principal investigator and like 1 or 2 assistants. Maybe you can get some, some research out, but there is so much involvement in research. I mean, I actually did a practitioner panel right after this, and I had a picture of my team, and in that picture there were probably 12 people. And we still have so many undergraduate students helping us with our project. And so just how many people are involved in research, I never thought it could, encompass that many individuals and that much knowledge. And I really love in terms of collaboration, how everyone so one of the things was when I first started, I felt like how Janisha mentioned, you kind of feel inferior. You're kind of like, you know, this is my first time, my first job, my first experience coordinating. But in collaboration, it was nice to see that my opinions were heard, I guess, and so accepted. And it actually led to some change. So like, for example, all in this project, when I first started, it was one thing. And then I was like, you know, I kind of think that maybe we'll experience some loss to follow up with this study. What if we do this? And it actually happened. And so I felt really proud of myself where I was like, oh my gosh, I made this huge change to the project and it's been super successful. And so knowing that I have a voice and that people are listening to it, I guess was surprising in a way. I know that sounds kind of sad, but yeah, I didn't feel as inferior as I don't feel as inferior now as when I first started. And so I guess that was sort of a surprising experience for myself in the decision.
That's wonderful to hear, and each of you are gaining confidence, and it's so wonderful to see that from when you were in the class to where you are now, and the confidence that you gained is just awesome, and they're all smiling on that, so that makes us smile as well. I have several more questions that are floating through my mind because I'm learning so much just from listening to our panelists, but I also want each of you to have an opportunity to ask questions, so as you're thinking about your questions, I'm going to pose another one to our panel. And that is to ask you to reflect back, and I know for some of you, for at least one or two of you, it may have been challenging, but in this class, we did have an assignment for having a practice-based opportunity to where you would sit in on a public health meeting, and for a couple of you at least, that was probably virtual, but having that exposure to what's happening in the real world. So each of our students has sat in on a public health meeting. I think everybody's done that as of today. But that exposure to what's happening in the real world as a student, can you reflect back on whether it was the experience in this class or other classes, being able to connect with those who are actively working in the field, and what kind of difference that made for you as you gained the confidence to move into the work world?
I guess I can start because I actually remember exactly what I did.
Awesome.
So I remember I attended a meeting in Greenville, South Carolina for a program called Access Health. And so I remember sitting in that room and listening to all the practitioners, all involved with Prisma Health at that time, Prisma and a couple other sort of small practices on how they can better provide services to the community, to those sort of underserved populations. And so they were talking about budgeting and planning and programs and education and stuff. And so all of that, it's like 100% what I've been doing now is meeting with collaborators from different organizations, learning how we can both benefit from like the research that we're doing, and building the confidence in that meeting. I remember I was really quiet, but I did try my best to ask questions because my first one in there, I didn't really even know what Access Health was. And so yeah, I definitely gained confidence in that, kind of understood how collaboration works and what that looks like in the real world, and I do all of that now. And so it was a very enlightening experience. It was really interesting to see and how it's transcended now to something I actually sit in myself. And so, yeah.
Thank you for reflecting on that. Landon?
So it's been a couple years for me, but I do remember it was with Deodas, and from what I remember, there was a ridiculous number of people there. Like, I thought I was going to go into a meeting and it was going to be like 15 or 20 people, and I was going to be involved and talk kind of like this, but that was not the case. It was like a whole auditorium full of people, and I remember about halfway through they actually started to do work groups and actually started to do the work. So I thought it was going to be just a meeting where they talked about what their priorities were and how everything was going in the organization and all that, but about halfway through they broke us all into work groups, and the students that were there actually had to be on one of the work groups. So coming into it, coming in not being an expert in that field, it was a little bit challenging at first, but as I sat through the meeting, I started to understand how much of it actually overlapped with my interests, which was really, really interesting. And then to actually see how they started with the work group and they talked everything through, and then they brought it back to the panel and they kind of talked it out together, and seeing how that process actually worked. That was the first time I got to see it, and it is a very common occurrence now in my job. So that was awesome to see.
Mine seems like it was a very long time ago too, and it was virtual. It was one of the first virtual ones. So I attended a steering committee meeting for the Beckley Mental Health Center, and they were talking about like a bunch of different people from different parts, like clinicians, psychiatrists, nonprofit workers, outreach workers, all talking about how they adjusted basically to COVID. on this virtual meeting, and I just thought it was really awesome, like their resilience. Like they were talking about having virtual support groups that started later in the morning because youth like to sleep in, or like how the youth in their center can text them if they need like mental health advice or if they're going through something right now. So that's all I remember of it, but I just really was amazed about how much they did and how resilient they were, moving from being in person and seeing their people to not seeing them or only virtually.
Thank you for reflecting on that, because that's something that our students have navigated this semester, but it's also something that Dr. Weiss really envisioned early on when we were teaching this class many years ago, to kind of get folks out into the community and to just observe a meeting so that you begin to see, hopefully, yourself in that setting moving forward. And now all of you are in that setting. So I want to open it up for questions from the group. So what questions do you have for our panelists? This is your opportunity to pick their brains and to get a sense of what might help you navigate the next year or two of your time in graduate school, and also making your way into the workforce. So what questions do you have for our panel?
So currently I'm doing my GA-ship at DHEC in the cancer registry. Super fun, love it. But in your experience with like looking for jobs and like descriptions on how they're matching up with what you're actually doing, would you recommend organizations like state agencies like DHEC as like really good resources to kind of focus in on if you're just wanting to make some of those first professional steps? Just because it's one of the more obvious choices in the state, because it's DHEC, everyone knows it. But are there other organizations you wish you had known about, or other avenues in job searching that you wish you had known about beforehand?
Go first on that. Sure.
Like DHEC.
So working for DHEC.
I'll answer that last part first. I would say that the social network that you make now while you're in school is probably going to be the single most important thing you do as far as finding a job. Just knowing people, because like now that I've been at DHEC for a little while, the connections that I am making, I'm like, oh, it'd be kind of cool to work there one day, or it'd be kind of cool to work there, because then you get experience and you get exposed to the work that they're doing. So I would say that from that standpoint, working at a state agency is awesome. As far as the job descriptions that the state agency gives you, I would say to talk to the supervisor of that position. Like, talk to somebody that knows about the job, and then you get a better idea than what they have written on there, because they have to go by certain constraints a lot of the times, and it misses out on a lot of the stuff that you'll actually be doing and a lot of the stuff that you won't be doing. So definitely don't be afraid to contact some of those people, because like she said, pretty much everybody that I've worked with so far and everybody that I've contacted, they're all nice, like unnecessarily nice. It's been awesome. It's been a great experience. It's been refreshing. But it's like, really? Okay, I've never met you before, but you're responding to my email in like 2 hours. So it's a nice experience. So I would say start there.
Glad to know we have an outbreak of nice. What's happening?
And I think so too, you mentioned sort of the job descriptions with DHEC. So when I first started, again, it was my first application, so I saw that job description and I was like, oh my gosh, like, what? I don't think I've touched on every single bullet point that they list on there of what they expect from someone to apply for. And so I did apply, I didn't get in. But I also think that, DHEC, yes, it's like the center, it's the biggest agency here, but there's so many little public health agencies, like, for example, IMPH, like, I don't think they get enough publicity. So, or like, Institute for Families and Society, and like beyond, there's PASOs with the Hispanic population. There's all these different public health agencies everywhere that are small and are looking for people, and it's needed, those sort of niche areas. And so I don't think you should limit yourself to just the state health department, although yes, I do think that would be a great opportunity if you do get in. But I do recommend for sort of reaching out and trying to get a connection with DHEC, because like, for example, I don't have any connections not currently, I do have one, but back then I didn't have any connections or knew of anyone that was currently working at DHEC. So I found it really useful to look through LinkedIn and search people that have the opportunity that I would have applied for, and reach out and be like, hi, my name's blah, blah, blah. I was hoping if we could talk, like just a quick chat. I want to talk about, I'm interested in what you're doing. I want to learn more about what your job entails. I'm looking to apply to that position. There's an opening here and here. And so that is super beneficial. That can already, boom, you just made a connection right there, because everyone on LinkedIn is also very unnecessarily nice. And so, so that is where I was able to, I reached out there, made a bunch of connections that way. And so I would suggest something like that if you want to look for those sort of other areas other than just the state health department, so.
Ditto what Chloe said, but also think too about even looking, because public health is literally everywhere, and looking at non-traditional places, maybe even like smaller healthcare systems like Regenesis Healthcare, Self Regional, Lexington Medical Center, all, like, you never think about it, like, I would never think a public health person would be needed there, and then they always are, or even looking at like corporate wellness, or working for the city of Columbia, working for the state. There's so many things out there that you can do that are within your knowledge and expertise that you never think about.
So just to add one more comment to that, like one thing that I'm working on right now is bringing together like several different organizations under what's called Healthy Palmetto, and that's a very, very niche thing, right? That's just for active living and healthy eating. So that doesn't include anything that they would really have going on, but that's over 28 organizations right now by itself, and all of those organizations have employees. So I know of about 4 of them coming into this, so I would definitely say there's a lot more out there than you would think.
Yes, Lee?
Kind of going off of that and a comment that was made earlier, so there's so much out there, how do you, it just seems really overwhelming, like I don't even know where do you begin.
It is overwhelming.
Yeah. I would say that just to kind of start us off a little bit, that depends on your interests. I would say to definitely take some time and define your interests as much as you possibly can. Like I will say this for myself, I still don't know exactly what it is that I want to do for the rest of my life. So like I don't have everything figured out by any means, but at least have an idea of what you're trying to do, and that'll narrow it down a lot. And then use your resources that you have, whether it be your connections or the different organizations that you already know about, and see what's out there that falls within that scope. And eventually it will be narrowed down enough to where it's okay for you to be able to put that many cover letters and applications out. Like, it's not overwhelming anymore. But definitely to look at it the first time and to look at all of it overviewed likewise, yeah, it's rough at first. But
Yeah, it's very overwhelming. I think I kind of stuck with sort of that I wanted to do something predominantly that was sort of based on minority population. So I'm Hispanic myself, and so I feel like I have a huge desire to like do anything that could positively affect the Hispanic population. So I've stuck with infectious disease for now. So like I'm really interested in potentially in the future considering a PhD in something like that, something like infectious disease affecting the Hispanic population, and taking that research. Who knows? I might end up back in Puerto Rico. I don't know. But that's something very broad, just infectious disease and minority populations. And so there's so many little things off of that I could potentially start off with, whether that be at a small public health agency that focuses on something like that, or seeking a PhD in the future in something like that. And so I started off very broad, and I said, okay, let me do this. But I also, again, like I mentioned, I dabbled in all kinds of stuff to try and figure out what I wanted to do, and that's like what I aspired to do. So it took this experience and this time in my master's to do that, to then go ahead and focus on those things later on. So.
And I'll add, I know 3 people with MPHs that started their own consulting firm where they do strategic planning and other things. So even thinking about, why do I have to work for someone when I can even work for myself? You can literally do anything.
What other questions?
I have kind of 2 questions, and I can't remember names.
It's okay.
Janisha, Landon, and Chloe.
Okay, so one of them, I guess, kind of was what Janisha was saying about the people that you graduated having kind of a different job. So is there anything that you guys can think of, anybody who you graduated with that have really out of the box jobs? I was told somebody that graduated with a dual master's in public health was doing lobbying for a sexual assaults, thing in Washington DC. It's nothing that you even think of. So is there anything that you guys can think of about that? And then I'd also be interested in hearing about your social determinants of health and what you're doing to address the issues.
Mm-hmm.
Well, in terms of off the wall jobs, I guess, or something that's surprising is, and I'm gonna piggyback on Dr. Billings, because that's who I had the most exposure with during my last year of my master's, and so she has such a cool job. She does consulting for what's called centering. So it's centering maternal care. So it's centering, it's a form of prenatal education. And so doing group discussion versus individual prenatal visits. and how that could address maternal health disparities. And so she does something like that, but she does that all over the world. Like she travels everywhere to promote this program in places like, I think she was in Dublin one time, and then she was like, oh, I'm gonna be in Africa. And I'm like, oh, that's cool. Like, you know, so she's just absolutely everywhere. I think that's really cool to actually see, because that's something that I would love to do as well, like do something international and take my expertise beyond South Carolina alone, which can feel so small. And so even then, like, and I almost had this opportunity while I was in my position. I was supposed to go to the Congo recently. That actually didn't get approved. So I mean, those things like that, it just didn't happen. And so, but yeah, those kind of positions where it's just not here, it's everywhere. Like you can literally do this anywhere. Like that's what's really cool to me. And those are like surprising things. You're like, oh my gosh, that's crazy. So yeah.
I feel like I don't really have a really good answer for that. I only had like 3 people in my like cohort that went through, and from what I understand, we all kind of ended up in physical activity related jobs. But you know, as far as I'm concerned, that's a good thing. That means we all found jobs, which is awesome.
Okay. So to answer the first question, someone who was a project coordinator, I believe at First Steps, recently transitioned to being an HR manager for the Tampa Bay Buccaneers. I don't know how, but it's so random, like a football team. But, oh yeah, so the other question about social determinants of health. So buckle in for a minute. So I coordinate a project right now where we try to address social determinants of health by getting together 3 think tanks of thought leaders from all over the state primarily, and a few in North Carolina as well. So we have 3 cores that we're pulling together. One of them is the data core. That one's focused on like our big data geeks and all of our people who say like, okay, so how can we get together and make a decision on data infrastructure to kind of help with, like, for example, say I work at SC Housing, and I have just referred someone to the hospital for whatever reason. My hospital wants to know if they get housing from me, if their health improves. I want to know if they get treatment from the hospital, and so on and so forth. So really kind of having that data sharing just generally to know, like, if I help this person, are they actually going to go get the help? And is this going to improve their health? So, and then having a platform, a shared data platform that we can just put up on the internet that certain organizations will have access to, so everyone can see, like, oh yes, I sent them down to MUSC and they did go get a primary care doctor or something like that. So that's one of the biggest focuses of the data core. The programmatic core is really focused on building community capacity and community engagement, really listening to community voice and getting people together. So that one it's been so long I've already forgotten what we're doing. But that's basically it. We're just really trying to figure out how to get that community voice in there so we can say, okay, so we like to think of it as a road. We call our initiative the roadmap. And so we have a road and it's got potholes. You South Carolina, we got a lot of potholes. So programmatic core is thinking, what can we do to fill in those potholes so that we can all keep driving down this road and we don't have to get stuck and stuff. And the last core I'll talk about is the administrative core, and that's really like the financing piece as well as the policy piece. We love grants, we live off grants, but especially for our nonprofits and our community-based organizations, it's not sustainable. So how do we get like sustainable programs so people can continue to get the help that they need from the nonprofits, community-based organizations? How do we keep funding the housing and the food shares and so on without having to continually apply for grants or beg for money, because maybe this organization wants to do some great work, but their lights are getting shut off. So stuff like that for the administrative board. All of that to say that we all come together and try to just get some agreement on these points of infrastructure to make decisions on eventually addressing the social determinants of health in South Carolina. And we are at the very beginning phase of it.
Very important work that we do have many potholes we need to have filled. So figuratively and literally,
Yes.
thank you for sharing that. What other questions do you have for our panelists? Joey?
I'm getting way ahead of myself, but one of our professors, Dr. Kinnison, seems to think that within the next year or so, I love her too. A lot of people her age, she says, will be retiring, and a lot of managerial positions will be opening up. Are you all starting to see that I mean, I'll be lucky to just get like an entry-level job, and do you feel prepared, having been, like a year or two into the workforce, for those positions that might be opening up?
I don't know about y'all, but my boss, she does everything right now, and she's done everything for a long time. So I think that I would be happy to move up, but there is a good gap between me and where she's at. I would definitely say that I would want several more years of experience and learning from her before I would be comfortable with taking on her role. But I would say that managerial roles and even entry-level roles, I believe, will start to open up soon. I'm hoping at least.
Yeah, definitely. I don't know if I would say I feel prepared. I would be willing to apply.
Yeah.
I would definitely like take the risk and go for it, because you never know. Would I be scared? Yeah. But I think just with this 1 year alone, I've learned so much that I would think I would definitely meet some of the things that were needed for that job, but I still need experience with like budgeting. I think that's my biggest like drawback, because I have not very much experience with budgeting and sort of the process of handling money and such, and so I don't know if I want to get into that, but I'm willing to learn. And so depending on what the position is seeking for, I would definitely apply if I thought I could definitely, accomplish it. But I wouldn't, I'm not sure if like those, with time, I'm assuming with the field, it's getting a lot more. I mean, y'all, this class is really big. When we started, and we were just talking, Landon was mentioning this class was 7 people, you mentioned?
And it was like 12 or 13.
12 or 13 people, so there's a lot of people in the public health field now, and there are a lot of positions open, and so I think it's getting a little bit more competitive, but there's just so much available out there to try, and so many positions now that it has become such a big field, and so don't be afraid to apply for something like that if you think you can definitely meet the criteria that's needed there, and yeah, that's what I would recommend.
Yeah. For myself, I can barely manage myself, nevertheless, other people. But and a lot of times too, we were actually talking about this in the before class. It's like people are retiring, but they're still like working in the field, so you'll still see them around.
Yeah.
But I just like, especially post-pandemic and everything, it seems like we're kind of becoming less of a work society and actually a take care of yourself society, hopefully. So I don't want to like get into a position where I am completely overwhelmed and I just can't handle it, because I've been there. And it's just like, so for now, I'm like, I'm good.
Yeah.
All that to say, I'm good.
Yeah. And also with those entry-level positions, I feel like I do have I have gained that experience of managing. So as a program coordinator, I am managing, whether that be like actual coordinating with, and so I'm not coordinating like directors and stuff, but I'm coordinating, just starting off with like undergraduate students, I coordinate what they need to do, I help coordinate their research, and so I have something entry level like that can get you the experience needed to do something like manage something. So yeah, I would apply for those entry level jobs just to get that more experience if you don't have it, but they are really beneficial to get to something like a manager position. So, yeah.
Each of you mentioned something that I really would like for you to expand on, and that is the intentional approach that you made to building contacts and kind of cultivating that network of support that each of you has drawn on as you made that transition from school to work. What lessons learned can you share with us about how you successfully built that array of contacts, and then what advice would you have about how we should begin to do that for ourselves?
Well, I think with our experience is so interesting because we're all pandemic exposed professionals, I guess, and so it goes to show that even through something like that, you can still collaborate and still communicate and still form relationships with people. And so I think I made more connections during my master's and during that online exposure than anything. I have so many people in all kinds of different fields that do all kinds of different things, and then we all still come together, and we still, randomly you'll see them in a meeting and you're like, oh my gosh, hello, how are you? And so the collaboration never ends too, it just doesn't. I can connect with people and make that network for every single day of my life. It's just gonna happen. And so, but even then it's not scary. Sending an email is not scary. There's no need to be scared. And there's also, I think it's it's not as hard as it sounds, I guess, to make something like that, to make a connection. And public health is all about collaboration. So I think everyone has that sort of joint understanding that that's what's needed to be able to get work done. Like, it's just how it works. So yeah, that's my piece.
So I would say specifically for you guys, the people in this building, like I said that a couple times already, definitely, but my experience having my exercise science degree here, I had a lot of great professors, but whenever I got into my master's degree, it was like the teachers were able to invest more time per student, if that makes sense. So they get to know you, they get to know your interests, take advantage of that, and make sure that you keep those connections with the people that you actually got along with and have similar interests to you while you're here. And then I would say once you actually get into your position, it's like trying just to keep up with the number of people that you come in contact with. If you're able to like go through your day-to-day job, you will make connections that way without actually having to proactively do it. You should still definitely proactively do it, but you're going to be meeting so many people as long as you can actually understand where their role is comparatively to your job and actually get to know them and remember their name, like actually remember who they are, then within no time you're going to have a ridiculous wealth of people to reach out to with pretty much anything that you need to know. Just be nice, like everybody else in this field. Yeah.
There's a theme developing here. We're all supposed to be nice.
And like people are usually willing to help you, especially if you're just like, hey, I'm a young student and I'm interested in this. Can you tell me more about what you do? And so when I was a student, I was annoying. I would just be in people's offices like, hey, I'm here, what do you do? Help me, please. But especially now, being a project coordinator and sending millions of emails every day, it's a double-edged sword because they all like know my name because you get emails from me like 3 times a week or whatever else. But you really kind of get to see each other, at least for me, through little Zoom boxes. Seeing each other, like kind of like Landon said, seeing each other in passing and just kind of being like, oh, hey, how are you? How's the kids? Whatever else. So I'm not an expert at the peopling part of it, but I've seen my supervisor just like build rapport like so easy and try to like help people out. So offering help, and they'll usually offer you help as well.
And I just wanted to add, don't be afraid to connect with each other. Like, all of you are going to be in such amazing positions. It doesn't feel like that now, but like later on you're going to be in such like big positions, and eventually you'll have to communicate with each other, and like you can learn something from the person sitting next to you and like make a really amazing connection just with someone. Oh, I just saw y'all. I understand. But yeah, so like in those projects, like keeping up with the people, not only in your concentration, but in all those other concentrations. I mean, it's like, I still keep up with the people that were in my MPH class. I mean, and they're doing such amazing things. And so if I need something from this person that's all the way in like New York or something, like I know someone who's doing clinical research all the way in New York in a huge hospital in New York or something. And so if I want to be like, hey, I'm super interested in that, like, can you send me some of your information? Do you have like, I need some data. Do you guys have any data over there that I could like use or something like that? I mean, it's just, yeah, right now it doesn't feel like it. You all just feel like classmates and such and students, but it's super important to just stay connected and yeah, because you can, you know, come up with amazing things just through communicating with each other. So, yeah.
Well, each of you are now valuable contacts for our class.
Yes.
So with your permission, we will share your contact information so that they
definitely.
can follow up as needed. I do want to reserve a few minutes for our panelists to give their final thoughts and advice. We promise not to take more than an hour of their evening, and so we're getting close to that, but I want to give an opportunity for any final questions that you may have for our panelists. Anything else that you would like to ask?
I know this is for the students, but yeah, it's so encouraging just to hear how different leaders in these state agencies are nice, they're receptive to your feedback. That's really encouraging. I feel like I should have been in South Carolina all this time.
It's a good place to be.
But I'm really interested in the collaboration aspect from a practical perspective, because state agencies are a bit bureaucratic. There can be power dynamics at play. So how did you all perhaps navigate that landscape, and what was your approach to be able to share your ideas or to help make like an impact?
So for myself, having to work with a lot of different state leaders, we had like the beginning doing our administrative core, because we have like our DHECs, our DSS, DHHS, all that together. And I remember hearing a concern, just like, why do you want me on this core? I'm not like the leader of DSS. And we really had to take a step back with them, not even moving on with the work of the core, just to get to know you basically. So we did so many like trust building exercises, which kind of sucked virtually, but they got their point across, just to put everybody on that level playing field. We also have code of conducts for each core as well, just to be like, just to like level it out, make it more horizontal.
Okay. So I would say that, I've only worked in one division, but so the way that it works is I know my bureau director and I know my division director so far pretty well. And my bureau director is extremely supportive of everything that my division does. His name is Barry Kelly, and he is a great resource. So he supports the division director, and then you guys know Lori, you guys do not, but she is, if you guys have seen Parks and Recreation, like a really, really positive version of Leslie. Like, she's always on her stuff, she's always involved in everything, and she's always got a lot of energy, which is it's great. Like, she's an awesome boss. But I would say that she would be receptive to any ideas that I may have at this point. And now, to your point, as far as like collective impact, so all of the stuff that I'm doing with Healthy Palmetto, that's the whole point of what we're trying to do. We have 8 priorities. Now it's down to 6 because we had to actually see who wanted to work with us and who didn't. But the 6 priorities that we have state leaders from around South Carolina that come together, and we convene just to make that point so that it is horizontal, so that we can all kind of strategize and align the work that we're trying to do. And it's been a very positive experience so far from what I've seen. So I would say that positive things on our end.
Yeah, and I think so too in terms of like my experience. I mean, I go back to IMPH and sort of seeing that there is still some impact in terms of like, I guess, in terms of divisiveness, I guess, in public health, sort of navigating that. Unfortunately, with the climate that we're in now, public health has become sort of like a political thing, and we're noticing some divisiveness there. And so just keeping myself open-minded and just hearing out the points, and also understanding that my voice can be heard, and just continuing on. That's how I stay motivated, is just like continuing on, like hearing other people's opinions and stuff, still taking those into account, but just doing the best I can in the environment that we're in. And so it keeps me going. It's like a push to just keep going, so I guess that's my 2 cents on that, but yeah.
That's a great question. So I would like to give our panelists an opportunity to reflect a little bit before we wrap up our panel tonight. Each of you need to think about the opportunity that you have in the future to be in one of these seats. So a future instructor will likely call on some of you in a couple of years to come back and tell your story. That same guidance was given to each of these 3 individuals. We said, imagine yourself, when we had our guest panelists, imagine yourself in these seats in a few years, and here you are. And so I would just ask that you kind of offer a final reflection about the advice you would have given to yourself a few years back when you were in this class, knowing that you're now a panelist. What advice would you have given to yourself and to these fine students to carry with them moving forward?
That's a big question. There's so much. Yeah. I think it's just too much that I can't even put it into words. Like
another theater production.
I know, yeah, like wow. But yeah, I wouldn't even know where to start, I guess. So can you repeat the question one more time for me, please? I think it's like so much. It's like, whoa, I just lost the question.
Well, it's the idea of moving from being a student to a panelist. You've now made that leap. What advice would you have given to your former self, sitting in these seats, so that it can hopefully guide these folks moving forward?
Yeah, I think it never ends, like the learning aspect of like public health and like what all it can be, it just doesn't end. Like there's only so much you can do in a small class, like in a class like this within like an hour and a half. I mean, it's just, it doesn't end, and all of it is involved in what you end up doing in the future. I feel like everything that I learned, I've applied. And yeah, and And I was sort of stuck in this sort of epi bubble. I was kind of stuck with my epi program. There were 4 of us in that program at that time. I believe it has grown like yeah.
Pandemic might have affected.
I think the pandemic somehow
People
skewed
discovered
that. Yeah.
It is now.
And so yeah, when I was sitting there, I didn't think I would ever be here. Like it does come to fruition, like sort of sitting in the classroom learning and stuff does lead to something like this. It just felt like with the pandemic and stuff, I guess it didn't feel like that as much for myself, but it does end up turning into this. And so listening in class, making those connections, taking down notes, really like absorbing everything that you can while you're here, but in the end, after you graduate, it just doesn't end. So just keeping yourself open-minded and like, there's just so much about public health that is out there, so.
I would say that, I guess my main takeaway from this is, despite all of the divisive stuff that we might have had to deal with in the last couple of years with public health, that everybody in this room, once you get to your job and once you actually start your career, you're all needed in whatever role that you're actually going to take, and you're all actually going to be important. And if you stick with this and what you're doing, you will eventually help somebody out. So.
1, group projects never end.
That's not what they wanted to hear.
But 2, the best advice that was given to me is don't overthink it. I know I've sat there agonizing over emails or whatever else. Just don't overthink it. Just do it. 9 times out of 10, they'll be nice. Actually, 9.5 times out of 10, they'll be nice. And I guess too, just remember why you're doing this. If you are doing this, which I assume you are, for the people that you're serving, just keep that always at the forefront of your mind.
It's a good focus to maintain and to realize that we're here to help others and to work together collaboratively. So thank you for being with us tonight. Please join me in giving a round of applause. You're all amazing, and we appreciate you so much. We have a little thank you for each of you on behalf of our class. But we also invite you to stay for chocolate chip cookies. So that is an added perk due to Dr. Weiss's birthday. I do want to give a shout out to Grant Jackson, our resident now videographer it seems. He's in almost everyone's class. So we this panel is being recorded for the benefit of those who cannot be here tonight, but also the 27 students who are in the online version of this class. So there are actually 50 total. We have 23 in this class, there's 27 online, so 50 students total in program planning this semester. So yes, the numbers have grown, which is a nice thing. Thanks to Grant, we can share your guidance with our online students as well, and I know they will appreciate it too. So thank you again for being with us and taking time out of your evening to be with us. So, and now we will enjoy celebrating Dr. Weiss's birthday. We'll move into our break time, and then we will be sending each of you your feedback from draft 2 sometime during break. I think the emails are ready to go. I have to go upstairs and send mine, but please feel free to move about the cabin.